10 facts about your pelvic floor. Fact 1. Some people think that the pelvic floor is made up of just one layer of muscle, but the pelvic floor is made up of many layers of muscles. These muscles have important functions. They keep you dry, they support the pelvic organs and the pelvic bones that make up your pelvis, and they contribute to sexual functioning as well. Fact 2. Pelvic floor makes up the base of your core. A lot of times people think that the core is just made up of those six-pack muscles, your abdominal muscles in the front. But your core is made up of your diaphragm at the top, your abdominal muscles in the front, your back muscles in back, and then your pelvic floor muscles at the base. And you need a strong base to have a stable core. So don't forget to strengthen your pelvic floor muscles when you're working on your core. Fact 3. Did you know that your pelvic floor muscles were named after a dude? Of course. Dude. Maybe you've heard your pelvic floor muscles referred to as Kegel muscles, or the strengthening exercises to strengthen your pelvic floor muscles referred to as Kegel exercises. The name Kegel is named after a gynecologist in the 1940s, this guy, who identified pelvic floor muscles and the strengthening exercises to get them stronger. Fact 4. Did you know that men do not have pelvic floor muscles? Just kidding. Of course, men have pelvic floor muscles. They actually have the same pelvic floor muscles as women. They're just situated, positioned differently for obvious reasons, but they function the same. Fact 5. Did you know that in some countries, pelvic floor rehab is included in postpartum care, fully covered by insurance, up to about 10 sessions with a pelvic floor physical therapist? And the United States is one of those countries. Just kidding! Of course the United States is not one of those countries. France is one of those countries. You have to be your own advocate for seeing a pelvic floor physical therapist after giving birth. Fact 6. During that active stage of labor and delivery where you're pushing, you may think that you need to squeeze your pelvic floor muscles to help push the baby out. That's not true. You need to relax the pelvic floor muscles and push from your abdominals. This is one of the times that you need to relax your pelvic floor muscles. Fact 7. Did you know that there are different fibers in your pelvic floor muscles? There are fibers in the muscles that kick in when you cough, laugh, or sneeze. There are fibers that also kick in when you're on a long bus ride and you can't get to the bathroom for a while and you have to hold it. So remember, when you're contracting your pelvic floor muscles and you're working on strengthening them, make sure that you do quick contractions and also long contractions where you're holding them for more than a few seconds. Fact 8. There are also fibers in the front of your pelvis as well as fibers in the back of your pelvis. So these fibers in the front of your pelvis kick in when you are trying to hold back urine. The fibers in the back of the muscle are the ones that kick in when you are trying to hold back gas. So when you're strengthening your pelvic floor muscles, remember to work on both the front of the pelvis and the back of the pelvis muscles. Fact 9. Are you a butt clencher? Some people hold tension in their bodies in their shoulders. Some people hold their stress and their tension in their pelvises. And when people can't release the tension in their pelvis, they end up with tight pelvic floor muscles. So be aware of where you tend to hold your stress. Try to relax your pelvic floor muscles. Fact 10. The pelvic floor muscles do get weak over time. There are age-related changes that happen. You could sustain trauma from childbirth, and you could have effects from decreased estrogen during menopause. But that doesn't mean that you can't strengthen your pelvic floor muscles. These are muscles just like any other muscles. They can be strengthened. So always work towards having a healthy pelvic floor.